Very much. Well, each and every Thursday, a doctor from Hartford HealthCare tackles your questions about COVID-19. Channel 3's Nicole Nalepa is getting some answers.
Dr. Henry Animadu, an infectious diseases specialist at the Hospital of Central Connecticut, is covering some of your questions about the coronavirus. He actually joins us now. And doctor, so many of our viewers have been writing in, so let's jump right into it. Our first question is from Sandra, and she said that her husband was diagnosed with COVID back in March and was intubated for almost 2 months. She says he was tested twice before leaving the hospital and then twice before leaving rehab. All 4 tests came back negative for COVID, and he was finally discharged May 19th. And she says on June 12th, he tested positive again. A second test was done June 26th, and again, positive. So why is he testing positive after being discharged negative?
So that can definitely happen. And I've had a personal experience with a patient who tested negative multiple times and eventually tested positive. Patients who recover from COVID-19 can continue to shed the viral RNA for weeks and sometimes even months. This may not necessarily mean a viable virus. The initial negative test could have been a false negative test. It is also possible that he became truly negative, but then got exposed to the virus again in June. But because he had antibodies, he didn't get sick from it. So this is not unusual, but it's not impossible as well.
So interesting. Our next question is from Ann in Old Saybrook. She wants to know, if your blood pressure is well controlled, are you still more at risk for COVID-19?
There is limited data on this. Hypertension or high blood pressure is considered by the CDC as a probable risk for severe COVID-19. But there is no clarity on whether a controlled blood pressure is better than an uncontrolled blood pressure. But I think there are definitely good reasons to keep your blood pressure controlled.
Thank you for all this information. Dr. Animadu will be joining us a little later on tonight to tackle more of your questions, so stay tuned. Thank you, doctor.